Today on Dr. Oz, the new gluten warning signs.
I had headaches almost every day.
This may solve the medical mystery inside your body.
We always associate gluten issues with the gut. It's not celiac disease.
The secret sensitivity making you sick.
I suspect probably 1 in 2 people is walking around with no idea about it.
You say it's actually the next epidemic.
And why you should skip the gluten-free aisle in the grocery store. Coming up next on Dr. Oz.
Today, the secret new warning signs of a condition you thought you knew everything about. Doctors are now paying attention to a new phenomenon called gluten sensitivity. It's real, and often you'll miss the symptoms because they don't bother your stomach, even though they wreak havoc on your life. There's a stunning breakthrough. I've got the new gluten warning signs every woman needs to know.
You've got brain fog, or your joints ache, or maybe your skin is breaking out in rashes. You suspect it's something you're eating. You've been tested for celiac disease, a severe intolerance to gluten, but no one can tell you what is going on. But your instincts tell you that a medical mystery is happening inside your body. Now, breakthrough medical research is shining the light on a new disorder called gluten sensitivity. It sets off a chain reaction in your immune system, and the symptoms extend way beyond your gut. Could you have gluten sensitivity? Today, the new gluten warning signs that you and your doctor need to know about.
Joining me now is Jennifer. Jennifer knew something was dangerously wrong with her, but for years, no one would take her seriously. So how long did you suffer seeing doctor after doctor with people telling you that you were, I guess they probably said you were crazy?
A few, but it was about 1.5 years, and I couldn't get any straight answers. I couldn't wake up in the morning. I was so tired that I felt completely drugged, even after 11 hours of sleep. And then my skin would break out in these rough, reddish, scaly patches that really hurt, even through my face.
The picture, I'm looking at it right now, that's remarkable.
It was just awful and embarrassing as well. Plus, I had headaches almost every day, and I had put on, over the course of a year, almost 20 pounds. You
did, yeah. We have a before and after picture. If I can show this to everybody.
Please.
It's pretty stunning. I mean, you look so good now, I've got to say. And I can see that. I mean, there are a lot of people walking around who look like you did on the left there, which is not bad, but it's probably not who you could be in life. So how'd you uncover the true culprit?
Well, I ended up in a nutritionist's office, and she did a ton of tests and discovered that food, not anything else, it was actually food, was the culprit. And she told me, you're gluten sensitive. And I was like, what is gluten? I had no idea. After this little crash course in learning how to take gluten out of my diet, after a week, I felt so much better than I had in years. The headaches disappeared, my skin started to clear up, I could wake up in the morning without an alarm, and after about 3 or 4 months, I lost that 20 pounds.
Yeah. I noticed a couple of these. We've talked about gluten, right? But this is not the usual gluten sensitivity things that you might think you know about. It's not celiac disease.
No.
And you didn't have intestinal problems, is the thing that you mentioned first, at least as discussed it here, which is what most people falsely think is the case. You have to start with your stomach if you have anything wrong with gluten problems. Let's show everybody what gluten is, just so we're all on the same page. I'm going to walk you through this. So gluten is a protein. It's found in wheat. Looks like this is also found in barley, and it's in rye also. It's valuable. It makes our bread fluffy. It makes our pizza stretchy. You know, all these things we want in life. Who wouldn't want to have this if they go out to dinner? It feels so good, right? It thickens our soups. We use it for making sauces. And when you eat these kinds of food, which most people in the audience would try to come after right now if they were allowed to get out of their seats, right? I mean, what would happen?
It was bad. I didn't feel like myself. Today, it's a completely different story. But I'm Italian. This was my life for most of, the 28 years beforehand.
All right, so don't move. I'm going to come right back because I want people to talk with you again in a second. Yeah. You're going to help us explain this to everybody. Joining me is Dr. Amy Myers, who's an MD who specializes in functional medicine. She's at the forefront of identifying the new gluten sensitivity warning signs. Welcome to the show, Dr. Myers.
Thanks so much for having me.
You say actually that gluten sensitivity is the next epidemic. And when I hear that story, and I see so many people walking around the way our first guest did, I see that as a possibility.
Yeah, Jennifer's story is very common. Doctors are familiar with celiac. They're familiar with even maybe gluten sensitivity and the digestive issues, but they're really not familiar with all the other symptoms like Jennifer talked about that it can cause. So we now know that at least 18 million people suffer from gluten sensitivity. And those are the people that figured it out. I mean, what about the ones who don't even know it? I suspect probably 1 in 2 people is walking around with chronic inflammation having no idea about it. In my clinic, I test everybody for gluten sensitivity, and about 95% of my patients have a gluten sensitivity.
And I'm struck, you said the word, the number 1 out of 2, which is a lot of people. And again, you mentioned this, but most doctors, most of you as patients, always thought that if you had gluten intolerance, you had to have an intestinal problem. You had to first have issues in your belly, and only afterwards would you get them elsewhere. I mean, Jennifer didn't report that, and you're arguing it's not the case as well.
No, I mean, we're now realizing more and more studies are coming out showing that this is the case, that it's all these other symptoms can be attributed to gluten. There was a study in the New England Journal of Medicine a few years ago linking 55 diseases to gluten.
And why did it take so long for us to put the pieces together?
You know, it really takes about, when something new gets discovered in medicine, it takes nearly 2 decades to come out into the mainstream, for us to learn about it in medical school, for clinicians to start using it in their practice. I mean, I never learned about this in medical school. I learned about a rare disease called celiac, but I certainly never learned about gluten sensitivity.
So let's go through the warning signs I want everyone at home now to keep track of. The first warning sign you actually argue is migraines and other types of headaches.
Yes, so again, we know about celiac, and we're now discovering all these other symptoms that can be caused. We know in general foods can cause migraines and headaches, so gluten's no different in that regard. There was a recent study showing that 56% of people who had migraine headaches actually had a gluten sensitivity. When they took the gluten out of their diet, their migraines resolved.
If there's someone who has migraines who's watching us right now, wouldn't that be the first thing you would do?
Absolutely. I mean, I had a guy in my clinic who had migraines for 9 years, 5 medications, not a day without a migraine. 3 days into eliminating gluten, migraine-free, by the time he came back to see me, off all of his medications.
It's remarkable.
Incredible.
Second big sign is brain fog. Why is that?
Yeah, so gluten can attack your brain and cause inflammation, causing brain fog.
Depression? Is it caused by the inflammation?
No, well, partly it can be, but also through nutritional deficiencies, that the gluten's disrupting the gut and your ability to digest and absorb certain nutrients like zinc and iron and B vitamins, omega-3 fatty acids, and vitamin D. All of these are important to brain and mood health.
How about the joint pains, the rashes that we see so often with folks with gluten intolerance?
Yes, that's absolutely inflammation. Those are just outward manifestations of inflammation.
So I don't want anyone out there to miss the one reality here. Look at that list back there. Nowhere do I mention belly symptoms. Nowhere. And how we think about eating food, and a pizza, for example, and how that might influence our getting a headache or a joint pain, that's the focus here. That's what we're trying to get across to everybody. So let me show everyone what we're talking about. I'm going to go back over here to Jennifer. Poor Jennifer's holding some gluten. So Jennifer and 4 volunteers are going to show exactly what's going on here. So Jennifer, you're the immune system, okay? And you're holding a pizza.
Yes.
Now, a normal immune system wouldn't have a problem. But if you're having issues with gluten, then you do. So I want you to take a nice waft of that, all right? All right?
It smells very good.
Doesn't it? You want to have some of it.
Of course.
You can't have any, of course.
No.
But let's say you did. Let's say you chowed down voraciously on this pizza. The immune system reacts. And when it reacts, it begins to attack things around it. For example, it'll attack your joints. Yes. As the joints are seeing the immune system with the pizza, the gluten, it starts to act up, feeling uncomfortable. And our skin does what? It blows the whistle on the fact it's not happy. You see rashes. You don't have the complexion. As Jennifer showed in her image, you get changes that you don't want associated with the way your skin and face looks. And your brain does what? That is the worst kazoo playing. Give me this thing. God. I can do everything myself. All right. All right. It's a defective kazoo, but it's working now. All right. So the brain is making all kinds of sounds. Your brain is in a fog. It's not much better. Thank you. And the gut feels the immune response. And what happens? Nothing. The gut does nothing because it doesn't have to do everything. We always associate gluten issues with the gut. We got to wake up to the fact we can get all these problems, brain, skin, joints, with an inflamed immune system wreaking havoc in our body without any signs from our intestinal side. So Dr. Myers, when it comes to gluten issues, don't eat that. There's a spectrum. And I want you, if you can, to walk us through the spectrum. We first have, gluten-tolerant people who can eat whatever they want to eat. and then we have celiac way down there. So explain how this all works.
Absolutely. So these on this end of the spectrum can eat as much pizza and bagels as they want and have absolutely no problem. Then we have all the way down here on the other end of the spectrum, celiac, which is a devastating autoimmune disease, and even trace amounts of gluten can cause big problems for them. And then we have everything in between, which is gluten sensitivity. You can be one step away from no problem or one step towards celiac.
When you say 1 in 2 of us have gluten sensitivity, and thank you for putting it on our radar screen, it wakes me up and everyone up to the fact that we might have all kinds of crazy things happen. And the first step might be to deal with this. So let's walk and show everybody.
Yeah.
What's the first step to do when you think you have a gluten sensitivity issue? What would your doctor do, and what should you as a patient do?
So actually, I do 2 tests in my clinic. The first is a blood test for gluten sensitivity. Now, if you go to your traditional doctor, they may not be using this. They may just be testing for celiac disease. So you may need to come to a physician like myself in order to get this gluten sensitivity test. But don't worry, because everybody at home can do the other test that I have all my patients do, which is a 2-week trial of removing gluten, 100%. Nothing out of the bulk bin, nothing out of a package. Remove gluten for 2 weeks, see how you feel. If you feel better off of gluten or you feel worse when you add it back in, then you know you likely have a gluten sensitivity.
And if you're doing this 2-week test, I know you have to be really strict, very rigid in making sure that not even a little bit gets into your body. So explain how that works in the grocery store.
Yeah, so first of all, the reason that I have you avoid the packaged foods is because junk food is junk food, whether it has gluten in it or not. Then, even in packaged foods with other grains, gluten-free products, they contain grains that could have some cross-contamination through the processing plant. And also, even certified gluten-free products can have trace amounts of gluten in them and still be considered gluten-free and labeled gluten-free. So it's best to eat nothing out of a package, nothing out of the bulk bin during this 2-week trial, so you can be 100% gluten-free.
All right, so none of these things, just again, only for 2 weeks. After those 2 weeks, you can go back to what you were doing before. We're just trying to figure out if we have the right diagnosis, and it's free, and you control it. Now, what are people going to eat for those 2 weeks since you've taken away all the things we normally eat?
Tons of things, lots of great whole foods. So we have proteins here, we have fruits, we have vegetables, we have nuts and seeds. Lots of delicious food. So the sooner you can try this, the sooner you can determine yourself at home if you have a gluten sensitivity, and then get back to health.
Dr. Myers, thank you very, very much.
Thank you.
We'll be right back.